All right, well, obviously one of the biggest moments in your life is when you discover that you're going to have a baby. And at that point, boy, a million things run through your head, but there are some things you need to do right away. And Dr. Larissa Autry is an OBGYN with Walker's Women's Specialist, and she is here this morning to talk about that. Good morning.
Good morning.
So you have two children.
I do.
And everybody knows that I have a grown son now, a 19-year-old, not grown to me. And when you find out that you're going to have a baby, obviously everybody's different because some people have been planning forever. Some people are kind of surprised that they got pregnant so quickly. What's the first thing, though, you do when you discover?
One of the first things I always tell people to do is to call your obstetrician, or if you don't have one, then to find a board-certified obstetrician. A lot of that is word of mouth and how do you feel. It becomes a very special moment because you see this person once a month and then twice a month and then once a week, and it's almost like they're part of your family.
It really is.
So you have to find someone that you bond with, that you're close with, that's informed. And then the next thing is to figure out how far along you are so you can tell them when you call, because you want to get in very early to discuss pain medications if you're on any prescription medications, prenatal vitamins. So.
Because when you're of age to have a child, you really should already have someone that you're seeing regularly
Generally,
anyway.
yes.
But if you don't, that is why we say contact and find out right away.
Correct.
So are a lot of people finding out more today, like with the home pregnancy test, than ever before?
Yes, yes. So my favorite question to ask is, how many pregnancy tests did you take? Because people will say 9, 8. I'm like, after the first one, it's right.
Yeah.
So
because they're really accurate today, is
yes,
that right?
They are. There are a few that may be a little bit below the actual discriminatory zone to get it on a pregnancy test.
Yeah.
And they'll come to the office to get a blood test, but usually home pregnancy test is fine.
Okay, what if you are already on some type of medications?
The first thing is to call the prescribing physician and then to discuss it with your obstetrician. There are a lot of medications that you can take. It's not back, 50 years ago when you had to suffer through everything, but there are some medications that are okay in pregnancy, and there are some that need to be changed.
Now, for folks who were not trying to get pregnant, may have been socially drinking, partying a little bit, or they smoke, those type of things, when you find out that you're pregnant, obviously there's some changes that need to take place.
We need to move to quit. I always urge every woman to quit smoking, and there are some great options out there. Dialing 1-800-QUIT-NOW, and they'll pay for patches, and so there's very good options to quit smoking. So that's the first thing. And if you are drinking, then we definitely need to stop drinking.
So I would imagine there's a lot of concern if people were just normally socially drinking, though, and they didn't know they were pregnant for a few weeks. How dangerous is that?
Usually if it's just socially drinking, you went out for the movies and you were pregnant and didn't know it, that doesn't have as much as an effect as we think for people who are binge drinkers or who are technically the term alcoholics. And then we get concerned about the fetal alcohol syndrome.
Okay, what about nutrition?
Definitely eat. Well, we usually don't have to tell pregnant women that, but you need to eat small meals instead of big meals. Your stomach does a lot of changes while you're pregnant. So and to drink. I tell people to drink at least 20 ounces every 1 to 2 hours because you get dehydrated really quickly.
I will say drinking the water really makes all the difference, doesn't it?
Yes.
Because you can tell when you don't.
Yes, yes. If you get dehydrated, the further along you are, if you get dehydrated, you start having cramping, and then you think you may be going into labor, then you call the doctor. It's a hospital visit, so drinking really helps, especially in the summertime.
Yeah, and if you are, if you're fortunate, and should be one of the most happy times in your life, having that little girl or boy come into the world. It's really special.
It's very special. They've never been here before. I get to bring them into the world.
You got a good job, don't you?
I do have an excellent job.
All right, well, good to see you. Thank you so much. If you have more questions, again, you are located at?
Walker Baptist. We're at Walker Women's Specialist. Telephone number is 205-384-4801.
All right, you're delightful. All right, now let's...